My name is Dr. Lori Gerber, and I run a practice called Refresh Wellness Weight Loss and Cosmetics. We're in Newtown, Pennsylvania. We actually focus on wellness and healing the gut from the inside out and the body from the inside out, weight loss from a perspective of family, friends, and lifestyle modification, and cosmetics, basically to make you look good after you've been through all of the rest of our programs. Well, unfortunately, I mean, if you look at a map of the United States, it used to be that there was only, I think, 3 or 4 states, in the country that had more than 30% of their population obese, and now fast forward to current day, we're at 100%. Every state has the majority of the population obese. And it is an epidemic, unfortunately. That's due to chemical exposures, it's due to inflammation in our body, insulin resistance caused by exposures from every avenue, to be honest with you. So we have Buck's Biggest Weight Loss Challenge. We do them once a quarter, and the great thing is they're doing it with other people. So really it's kind of a community and family atmosphere, and you're doing it together. And it actually, we have a very high success rate. I think one of the biggest things that I do is educate patients about BHRT. I do have a lot of females that come in for weight loss, and unfortunately they're perimenopausal or postmenopausal, and have some big deficits in their hormones, and it makes it very difficult for weight loss in particular. But not only that, hot flashes, night sweats, brain fog, not being able to sleep, even mood swings, or even a woman not able to make lean muscle mass is due to testosterone problems. So my big thing is education. If they understand what they're up against and the risk to benefit ratio, that's really what I like to do. Of course, I do a lot of replacement, and I help a lot of people that way. Start low, go slow, that's kind of our motto. But and I find that my patients are much more successful in weight loss and keeping it off, especially because mentally they're there as well as physically. I believe in healing a lot more than just the actual sex hormones. So if I'm doing a progesterone cream, a lot of times I'm healing up the gut. I'm taking care of someone's stress levels and trying to work on their adrenals and that kind of thing as well. So very rarely do I kind of do a sole approach. The majority of the women that come see me are complaining of depression, anxiety, muscle aches. I get a lot of athletes too that have been training for a long period of time that are complaining of aches and pains that they never had before, that maybe have been diagnosed RA or fibromyalgia or generalized anxiety or depression. And from a perspective that I come from as a young physician who's been trained traditionally and non-traditionally in the A4M, I'm able to approach it from what I call the triad perspective, and we start to look at the inflammation that's going on in their body causing these systemic effects. So we can use omega-3s and other natural anti-inflammatories to help take down the inflammation in the system. And we can also try to heal up their stomachs to try to figure out, okay, do they have a gluten sensitivity? Are they not getting enough protein? Do they need longer acting carbohydrates when they're doing their endurance training? So from that perspective, I'm able to heal a lot of people that otherwise have been put on antidepressants, anxiety medications, or are told they can't be helped, or they just have arthritis or osteoarthritis because they work out too much, and actually get them to where they're happy again. That's the goal that I have in my practice, is to wake up every morning and feel good about yourself and feel happy and want to do the things that you like to do, as opposed to not doing things because you're tired or you're achy or you don't feel good. Live well, be well is, my motto at Refresh is actually healing from the inside out. When I first came out into practice, I was doing laser hair removal and some skin resurfacing. I've really progressed into doing almost all injectables, so I do everything from Botox, Juvederm, Radiesse, and the newer fillers on the market, to laser skin resurfacing and dermal remodeling. And also hair removal, but some of the newer fat contouring procedures as well. So I don't do smart lipo, but I will do liposonics, which is a focused heated ultrasound to heat up the fat cells and actually burst them about 1 inch below the skin surface. So I do that in addition to all of my other procedures, and that works really nicely with my weight loss program as well. We also do light chemical peels. I'm a big believer in kind of mixing up the therapies, dermal remodeling with the chemical peels, and then sometimes I'll go into doing some fillers and that kind of thing. If you'd like more information on Refresh Wellness, Weight Loss and Cosmetics, or anything that I offer, you can go to our Facebook page. You can go to our website, which is refreshwellness.net. We also have a blog on our website, as well as a Twitter and a LinkedIn account.